Every year, thousands of people undergo laser corrective eye surgery to correct their vision. New technology is making the procedure a lot simpler, and as I found out, it is transforming lives.
You just relax and breathe.
In just a few seconds,
Now remember, this laser doesn't make any kind of sound or smell.
my life will change.
Don't move or talk, just relax and breathe.
A laser is about to enter my eyes
Ignore the smell and sound, you're not going to feel a thing.
and forever improve the way I see the world.
Lock and load, 15 seconds, here we go.
When I was 10, I joined millions of Americans and started wearing eyeglasses.
Good evening, welcome to 8 News at 11.
Over the next few years, my vision got progressively worse, and eventually I switched to contacts. So every day for the past 12 years, I've used the small, clear blue lenses. That is until recently, when I decided to permanently take my glasses and contacts off and get LASIK eye surgery.
This procedure has become a lot more civilized.
Dr. Neil Wills of LASIK Plus has performed laser corrective surgery on some 53,000 eyes.
I see people from all walks of life, young and old.
The first thing his staff needs to do is determine whether my eyes qualify for the surgery.
We get the left eye covered up there with the right eye. Can you make those out?
FZBD4. Blink for me.
After some tests come back, my results are in and I'm good to go.
For your case, we're going to do two things. We need to use two lasers on you. An intralaser to create a flap on your eye, and then we need to use the wave light, the excimer laser, to reshape the surface of your eye.
The actual procedure will be very quick. First, a laser will cut a flap on each eye. Then, with the flap down, a second laser on a different machine will reshape my corneas, either making them flatter or steeper.
The laser treatment is going to take about 20 seconds. You're not going to hear it, you're not going to feel it, you're not going to smell it.
A lot of people fear LASIK, and it does have some side effects and risks. A few patients develop infection. Many others experience dry eyes and halo glare.
Nighttime, when you look at a light, you are going to see some halo and glare around the light. After about a week, that's going to start to clear, and that's going to continue to clear for the next 3 to 5 months.
Dr. Wills doesn't think I will have any of these complications, so I schedule my appointment and get ready for the big day.
Quite frankly, I think you'll fly through this without a hitch.
Coming up in just a few minutes, see the procedure right here on 8 News. In just a few minutes, I'm going to undergo laser corrective eye surgery and forever change the way I see the world. Now, we're about to show you the procedure. If you are squeamish, you may want to turn away.
The day of my LASIK surgery, I arrive early, having not worn my contacts for about a week.
Go ahead and put on this nice lovely cap on for me, please.
I'm shown special eye drops I'll have to use and instructed to go home immediately after the procedure and go to bed.
When you sleep for 1 week, you will need to wear these night shields.
With that, it's time to go into the surgery suite, where Dr. Wills gives me some last-minute advice.
For the first 6 hours, your eyes are going to burn, they're going to sting, they're going to water, they're going to be really irritated. So leave your hands out of your eyes. That's why you wear sunglasses.
So I'm ready. Numbing drops are put in both eyes, and I'm led to the first laser. Remember, this one cuts the flap.
Directly above you is a flashing light in the middle of a white circle. You see that?
Yep.
Just stare at that flashing light for me. So you just relax and breathe. 20 seconds, don't move or talk, just relax and breathe. Not going to feel or see a thing. The vision may go gray or black at this point, that's okay. Down to our last 10 seconds, you just relax and breathe. Everything looks perfect. You are doing great. Good job, good job. Down to our last 5 seconds. 3, 2, 1. You're going to release the pressure, pull you away from the laser. Okay, buddy, hard part's done.
During all this, I only feel a little pressure, no pain or discomfort. Well, after the same thing is done to my left eye, I stand up and move to the other laser, the one that will actually change my vision forever.
If you look directly above you, you should be able to find a flashing green light in the middle of 4 big stadium lights. You see that?
Dr. Wills holds down the flap, and I'm ready.
Ignore the smell and sound, you're not going to feel a thing. Lock and load, 15 seconds. Here we go. 15 seconds. That's it, that's it. Great concentration. Stay focused on the flashing green light. You got it, you got it.
In under 1 minute, it's done.
All right, amigo. It's a done deal. You did great. Nice job. You feel all right?
Yeah.
All right.
I already see better.
Yeah, it's hazy. I understand, but you know, it'll clear up.
With that, I head home, a little uncomfortable with one thing on my mind.
Just 6 hours of sleep.
When I get home, I put on my special sleeping shields and hit the sack for a long nap.
These are what my eyes look like 6 hours after surgery. I've just woken up. They feel A little uncomfortable, like there's a little sand in there, but not too bad.
In fact, as the hours go on and I use my prescription eye drops, the discomfort goes away and my vision improves. By the next morning,
for the first time in 15, 17 years, I woke up this morning and was able to see right away.
Just look straight ahead for me. I'll bring this right down in front of you.
that day I go in for a follow-up exam.
The flaps look great. They're nice and smooth. No sign of any infection or excess inflammation or anything like that.
My right eye registers at 20/20, my left eye 20/15. Proof that after years of contacts and glasses, LASIK indeed worked for me.
Well, after about a week of a little discomfort, things were fine, and my eyes were red for about a month, but gradually it went away. This is what my eyes look like tonight. I think we have a shot right there. So they look pretty normal and
Pretty.
They look
perfectly.
nice.
Right.
Absolutely. So the big question, of course, many folks now seeing this say, well, maybe I could do that.
Yeah.
How much did it cost?
You know, it depends on your eye and it depends on the laser they use. I did pay for my surgery, and each eye was about $1,000 to $2,000, so it just kind of depends.
Well, worth it for you, I'm sorry.
Yeah, no, Nate. Is it odd not having to wear glasses? Do you still reach for them in the morning on the nightstand?
It was really odd waking up the first few mornings and not putting in contacts or having to put them on, but I sure don't miss them.
Not at all, huh?
Not at all.
Okay,
Not at
wonderful.
all.
Nate, thanks for sharing your experience.
No worries, and if you want to see more or you missed part one of our report, visit our website, WRIC.com.
Fantastic. Thank you for sharing that
No
with
worries.
us.